Good afternoon, Mr. and Mrs. Smith. I know that you are so excited to be getting to go home from the hospital today, Mrs. Smith, and you guys have been really concerned, and I understand. You had a car accident about a month ago and had a concussion and suffered a seizure about a week later. And then last week you were brought in by ambulance after you had a seizure at work. So you've been diagnosed with epilepsy, and I know that this has been a big concern, but I hope that now that we've gotten the seizures under control, that you're confident and we can help you manage your symptoms. And one of the ways that we're going to do that is the doctor has prescribed Phenytoin or Dilantin for you. This is an anticonvulsant that works by slowing down the electrical impulses in your brain that cause seizures or convulsions. You will have to take this medication every day. To prevent side effects, you're going to start off taking the medication very slowly in a low dose over several weeks. We have to we've gotten in contact with your primary care provider and set up appointments for you to have blood work to make sure that you are getting the correct dose. This drug has a narrow therapeutic index, which means that if you are not taking enough, you could continue to have seizures. And if you are taking too much, it could be toxic to you, which could be very dangerous. Once that you find the right dose, though, you probably won't have to change that. It will stay the same. Other labs that he may want to draw would be a complete blood count, labs to check your kidney and liver functioning, glucose monitoring because this can raise your blood sugar, and a metabolic panel to check the sodium in your blood. Your primary care provider is going to monitor all of this for you, and your first appointment is tomorrow. I have put that appointment reminder in your discharge paperwork at the top. Phenytoin does have some side effects that we want you to be aware of. This drug is teratogenic, which means it causes birth defects. So while you are taking this medication, you must use birth control. Now, I know that in your chart, I looked and it says that you had a Mirena placed in January. Is that right? Okay, so you're going to need to have that replaced again 3 years, so it'll be January 2024. If you choose not to have that replaced, you will need to select another form of birth control while you continue to take this medication. This is extremely serious. I cannot say that enough. Other side effects that you may experience would be drowsiness, sleepiness, nervousness, shaky or nausea, or constipation. These will subside as your body gets used to taking the medication. Some people do have trouble with their gums becoming enlarged, and that can be managed by making sure you're performing good oral care and visiting your dentist and dental hygienist on a regular basis. It usually takes about 4 weeks for this medication to work properly. So this is because Phenytoin needs to be increased slowly to prevent side effects. You may still have seizures or pain during this time. If you are experiencing toxicity of the drug, you will have side effects like continuous nausea, confusion, poor coordination when you're walking, riding, eating, or you might have slurred speech. You could become unconscious or comatose. You could also have nystagmus, which is when your eyes may jerk back and forth or up and down involuntarily. And all of these things are severe side effects that we want you to immediately seek medical attention. I know that this is a lot of information to throw at you right now. So to recap, what you're going to be taking is an epilepsy medication. Do you remember the name? Yes, Dilantin. And this is an anticonvulsant. What will it do in your body? Yes, it's going to stop your brain from causing these seizures to happen. And it can take up to 4 weeks to see the results, the complete results that you want to see. There are a couple of extremely important things that you must do while taking this medication. Do you remember what they are? Yes, you have to use birth control because this could cause severe birth defects for any child. And then the second one is to monitor for what? Toxicity, yes. And you're going to seek immediate medical attention if this takes place. Did you have any questions for me? Yes, I do think a medical alert bracelet or necklace is a fantastic idea, and I can print out some things for your discharge paperwork. I can put that in there as to what things you want to include on that medical alert. I really have enjoyed taking care of you, and I hope that everything turns out well. Thank you so much, Miss Smith.